Dr. Bowden, we talked about malnutrition as a significant problem in the world, but also in the United States and specifically in Utah. So can you talk a little bit about the scope of malnutrition in our population today?
It's a little bit scary because it's something that you think about being, oh, this is something that happens in third world countries or where there's war, but it's happening here and it's a lot more prevalent than we might think. And I don't remember exact numbers, but something like 47 million households are dealing with food insecurity in the United States, which is about 13.8% of households. And that's a lot of people who aren't sure where their food is coming from. Yeah. And that's over 13 million children. And that kind of brings things a little bit to home to think about, okay, these kids that I see playing on the street, some of them don't have the food that they need. And then there's a good chunk that are the elderly who don't have a lot of appetite and don't have a lot of resources, and their nutritional status is just dropping.
Yeah, it's two vulnerable populations that are affected significantly, the children and people that are getting older. How does Utah compare to the United States? That was something that was a little bit surprising to me.
Yeah, Utah and New Mexico and South Carolina have the highest death rates from malnutrition, which is kind of surprising and a little bit sad that we have so much right here that we're not seeing.
Yeah. One of the comments was made, we have malnutrition and maybe they should be recognized, but what can be done about it? And I thought you had a really good answer to that.
So some of the challenge is connecting people with the resources that might be available to them. And it's helping people to understand that there are resources available, and also to understand that it doesn't take as much work as you might think to prepare a healthy meal. It may not be fancy, but it doesn't have to be something that is super time consuming. So, for example, a lot of people think fruits and vegetables, oh, well, I just can't get those fresh fruits and vegetables and eat them, and I have a hard time getting to the store. Frozen is your friend. Always think frozen is your friend because they're just as nutritious and it's easy. You can take some frozen vegetables, poke them in the microwave, and they're done. And it's already cut up. So there's not that time preparing that you might think, oh, I have to do all of this. Something as simple as taking a can of tuna, dumping it on a plate, sprinkling some dill on top, warm it if you want, and then serving with some frozen vegetables gives you a lot of good solid nutrition, and it takes just a couple of minutes. And I think part of it is people don't think about that, oh, I could do this and it would be really pretty easy. And that doesn't take much longer than poking a frozen dinner in the microwave.
So Utah has a lot of malnourished people, especially children and older people. And there's definitely some things that we can help with and some education that can go along with that. And I thought that was really positive. And then there was this sort of focus with the providers in the room on recognition. And although this is primarily for a patient audience, I thought it was really valuable to think about ways to recognize malnutrition. And what do you think are some of the best ways that that maybe all of us actually could use to recognize it?
I think one of the main things is to be very aware of the people in your life around you and to look at them and consider changes that you might see and recognize that maybe those changes are something that might need a little bit more prying into. So if you notice an elderly neighbor's face looks different than it has in the past, maybe talk to them about, hey, how are things going and how's food? It can be a weird conversation, But it's a little easier with your family to be able to say, hey, Grandpa, how are things going? Because you can see that change might have taken place. Some other things to consider are just looking, and you can see typically if someone's clothes aren't fitting the way they used to be able to fit. If things are hanging a little differently, if you notice they've got their belt cinched up tighter and their pants look like they're pulled in a lot, that maybe they've lost a bunch of weight. And that may have been deliberate, but oftentimes it's not.
Yeah.
And so just noticing some of those things, and then having sometimes hard conversations about food. And it can be a hard conversation because most of us are kind of independent. And especially as we get older, we don't want to feel like somebody else has to take care of us. But
that was one thing in the conversation, and maybe in both populations that we're describing, a reluctance to admit or to come to terms with a situation and to talk about it. And so definitely need to be aware of the feelings and things, but also attentive. I like that, just paying attention and recognizing that there are people in all of our lives that are not getting adequate nutrition, and it can have a profound effect on them and their health.
It can. And so part of that, going along with what you're saying, that sometimes those conversations can be challenging. We need to know people well enough to be able to have them be comfortable having that conversation with us. So building those relationships is important.
Yeah, I agree. Well, thank you so much for presenting this morning, and really appreciate just having insight coming from your expertise, nutrition and food and counseling with dietary things. And it's not something that a lot of practices have that resource available, and it's been wonderful for our community and for our practice and patients to have sort of that level of expertise and to think about that being a very important part of health. So thank you.
Thank you.